Professor Rachelle Buchbinder has two jobs. The first is running her small rheumatology practice in Melbourne.
You put your chin on your chest, put your head back.
And the second is as a distinguished researcher in the School of Public Health and Preventive Medicine at Monash University.
I get great satisfaction from doing both of them, and the patients just give me ideas for what needs to be studied.
But her career as a researcher got off to a shaky start when, as part of her PhD, she was tasked with giving lab rats arthritis.
When my supervisors were surprised that none of the rats had developed arthritis, I actually had to come clean and say I couldn't actually bring myself to inject the rats.
She went on to do a master's and later PhD in clinical epidemiology, the basic science of clinical medicine.
There's a lot of good things about modern medicine. We've had a lot of wonderful discoveries that have cured disease and increased people's longevity. But the current play is also that there is too much medicine, and we know from studies that about 30% of medical care provides no benefit to the patient, and about another 10% is actually harmful.
Professor Buchbinder is co-author of the book Hypocrisy, which argues the benefits of treatment are often overstated and harms understated, while overtreatment and overdiagnosis are rife. She says the result of medicine being driven by business models is a not fit-for-purpose medical system that prioritizes health care over health.
Well, if there was one thing that I could change, I would completely get rid of fee-for-service, and we would all be salaried. We'd all get the same income irrespective of how many patients we saw.
In 2009, she published the findings of a randomized placebo-controlled trial of vertebroplasty, a common treatment for painful spinal fractures that involves injecting the damaged vertebrae with a cement.
Even when we were doing the trial, I was already receiving negative feedback. People thought I was being unethical by studying a treatment that was well accepted. And my answer to that was, well, we don't know that it actually is better than not doing it, and we need to know the evidence, and I think it's unethical not to study the procedure.
Her conclusion that the treatment was no more effective than a placebo led to a flood of abusive emails and calls.
So when you think about the reasons that they're attacking me, often it's because they've got vested interests. They believe with their own eyes, so they think that what they see is the truth, and they don't understand that you need a control group, and that just because someone gets better with your care, it doesn't mean that it's because of your care.
The backlash only made Professor Buchbinder more determined. She's now published more than 20 musculoskeletal trials that have challenged the value of accepted treatments. But she's also committed to finding things that work, and was highly cited for evaluating a world-first media campaign in Victoria that successfully shifted misconceptions about back pain in the late 1990s.
That exercise is a safer and surer bet than an operation.
It was really at a time where you could use TV to get messages out to the general public. Unfortunately, I don't know that you can do it in the same way now.
That's why Professor Buchbinder says it's critical to keep exploring new ways of promoting evidence-based health messaging, something she hopes to do as a Fellow of the Australian Academy of Science.
And if you don't think about things in a scientific way, then you can end up with the wrong answers. You can be easily led by people that want you to believe something different to the truth.